Welcome back to Ozarks Tonight. Roughly 30% of college students self-report some kind of mental health disorder like anxiety, mood, or substance use disorder. This is according to a 2018 study that looked at 19 colleges in 8 countries, including the U.S. And coming up on May 1st, Missouri State University will be hosting the Impact Summit College Student Mental Health Conference. At this event, MSU hopes to add to the conversation of mental health in Springfield, raising awareness and erasing the stigma. So we wanted to get this conversation started here on Ozarks Tonight. So joining us now, we have Dr. Thomas Lane, the Dean of Students at MSU, and Jessica Allen, a graduate student on the Conference Advisory Committee. Thank you all so much for being here.
Thank you for having us.
So I wanted to talk about this summit. You know, when I first heard about it, I thought how interesting. We're starting the conversation surrounding college student mental health. Why have the summit here in Springfield, and who is it for?
It's a great question. This is actually our second annual summit. This came about when I started my role of Dean of Students about 4 years ago. It really became clear to me a lot of the challenges regarding mental health that our students bring to campus. And so we thought, how can we expand the conversation about college student mental health? So we decided to get folks from different varieties of backgrounds, from behavioral health clinicians to our counseling center director to representatives from different colleges in the community. And Cox Health as well too, to all talk about this conversation surrounding college student mental health. The statistics, I think, demand action. 1 in 12 students, according to national data, have a suicide plan or make a suicide plan at some point in time. Anxiety and depression continue to be leading causes of mental health concerns or leading symptoms of mental health concerns.
And what I found interesting is that you have a student, you're a grad student, Jessica, and you're part of the advisory committee. What is your job on this committee?
I am mainly there, like you said, for the student feedback, the student perspective, what will get more students to come to the conference, how can we pick out topics, how can we invite speakers that are going to best speak to what we're trying to do.
What are the resources on campus, and how do we make sure that students know about these resources, and not only do they know about them, but feel comfortable enough to know here's a counseling center I can go to, here's someone I can talk to. How do we make that connection from resources to students actually using them?
Missouri State has recently constructed our new Majors Health and Wellness Center, which has been a game changer for us in terms of heightening awareness about mental health resources on campus. Our counseling center is located on the 3rd floor of the new Majors Health and Wellness Center. It's a great environment, very relaxing, very soothing, very welcoming environment. In addition, we have both a psychologist and psychiatrist on the staff of the Majors Health Center, which is located on the 1st floor of that new facility. So I think that's helped heighten the awareness of our resources. We do a lot of training with our resident assistant staff and with other members of the campus community on how to recognize signs and symptoms when a student might be having a mental health concern. And so it's truly, I think, been a community conversation about this topic.
Jessica, your perspective on this, what was your experience as a student on campus in terms of these resources and being able to connect with them?
Sure. I actually went through a really hard time my sophomore year, and I had a professor who reached out to me and saw that something was going on, and she actually referred me to different services. So having a really strong campus community is really important at Missouri State, looking out for each other, breaking the stigma, as Dr. Lane mentioned earlier, destigmatizing mental illness and making it part of a common conversation. We also have a couple of student groups on campus who are advocates for mental health awareness and do awareness raising events surrounding that, and it's really done a lot to create this environment of understanding on our campus. We have fraternities and sororities taking initiative and starting the conversation surrounding mental health.
What was that like for you to have a professor reach out? I'm sure she was prepared and she was paying attention to those signs. What was that like for you, and what differences did you notice in yourself from before and then after someone reached out and you were connected with help?
I was really just caught up in everything that was going on. And it wasn't until she reached out to me and asked if there was anything that she could do that I even realized that maybe something is wrong. Maybe there is something I could do to get help. Maybe it doesn't always have to be like this. And so after she referred me to those resources, like the counseling center, like NAMI, I was able to immerse myself in a culture that was understanding of my mental health and wanted me to be better. And so from there on, my grades drastically improved. I became involved in a student organization. I took leadership in that student organization. My whole academic career really changed after that.
Early bird registration for the Impact Summit coming up on May 1st. Today's the last day, March 29th. But if you can't make it today, if you can't sign up today, you can still sign up through next week, I assume?
Space is limited to 300 participants. We are getting close to that number, so I would encourage people who are interested in attending the summit to register as soon as they can. We have two phenomenal keynote presenters. We have Dr. Nance Roy, who is the clinical director of the JED Foundation, which is a national foundation that focuses on college student mental health. And then very exciting news that we have our closing keynote, the actor Sean Astin, who has gone around the country talking about the importance of mental health awareness, and we're very excited about having him on campus.
All right. Dr. Lane and Jessica, thank you so much for being here.
Thank you.
Thank you.
We will have a link for you to sign up if you would like, and also a link to the study we mentioned earlier. That will be in the story on our website, ozarksfirst.com. We'll be right back with more right here on Ozarks Fox.